It's July, and we're back with our Healthy Steps edition on breaking down barriers and access to birth control, something A Step Ahead Foundation does every day. That is our mission. We are here to help you access and break down those barriers. And today we're going to talk about some of the more common ones, and one of those is financial. When I ordered my last IUD, insurance paid for only 80% of it. I had like a $250 out-of-pocket cost. And then for some people, it's the expense of taking off work to have the exam, and then you need to come back for the placement, and then maybe a 6-week checkup. Transportation as well. Some people are needing a bus card or an Uber or gas money. Is this something that you see much in your office, that people express some type of financial burden to access their birth control?
Yeah. For starters, the IUD in and of itself, with no insurance coverage, is over $1,000. And then, even when offices can carry IUDs, instead of having to order it, because if you come in and see me and you wanted a specific type of IUD,
oh sure, yes,
sometimes we have to order it. That takes like 4 more weeks. So we had a whole visit where we talked about ordering it, and then you have to come in 4 more weeks or so for the placement. So typically, as far as a time limitation goes, you're coming in, we're talking about it, then you're coming back for the placement. We recommend you come back for another visit 4 weeks after the placement to make sure it hasn't expulsed from your uterus. And let's say you have kids, you have a job.
I didn't even add babysitting. I gotta find a babysitter. Take care of the kid I already have.
And then on top of all that, if your insurance isn't going to pay for it, then that's another added barrier, which is where A Step Ahead is crucial, because if they can have the IUD, the Mirena lasts for 8 years, like the Liletta lasts for 8 years, the Paragard 10 years, but you have to be able to pay for the device. The insertion itself has a fee.
As an additional fee. Mm-hmm.
And if you got an ultrasound, that would have an additional fee. I will just mention that there was a study that came out showing that women that had an IUD placed under ultrasound guidance had better tolerance of the procedure.
Kind of off of the, kind of transportation, that financial burden is geographic. And in the region here that A Step Ahead works in, our 16 counties, we know that there is a lack of providers that can even insert an IUD.
OBGYN physicians that are trained now are going to be certified to place the arm implant, the IUD. But certain nurse practitioners, physician's assistants, family medicine doctors, that's all within their wheelhouse to do it, but they do need to do the certification. And not all family medicine residencies would necessarily certify that. Like at UT Medical Center, they're all certified on it. They do quite a bit of OB and GYN care. And then nurse practitioners, it just depends on what kind of nurse practitioner they want to be. And then if they get the certification, then they can do it. So like a family nurse practitioner, if they did the certification, then they could place it. Same thing with an OBGYN nurse practitioner, and then for physician's assistants.
Have you noticed any increase in your patient load considering the lack of OBGYNs we have in this region? Everyone just has to come to the city.
People come to my office from far away, especially for their prenatal care.
Oh, absolutely.
They're like, and it definitely is nerve-wracking too when they're like,
38
I'm 3 centimeters dilated.
And they live an hour and a half away.
And they're all like, I live an hour and a half away, or I live 2 hours away. Now not only are they doing all this for their prenatal care, but they're doing it for their annuals and for their IUD and their checkups.
And then there is the social barrier to birth control. Still culturally and in some religious groups, there is kind of this negative connotation of birth control. And I know that we've talked it to death at this point between the two of us that, birth control is not always for controlling birth. There's so many other reasons that women need access to birth control. Do you see any type of cultural or social barrier in your office? How would a patient approach you if maybe they had some type of barrier? They personally wanted it, but maybe a spouse or mother or father figure in their life really did not like the idea of birth control.
I will say that I have had quite a bit of mother-daughters come in that I think is really refreshing. because I don't know that that was totally a thing when I was a teenager. I don't know that all my friends went to the OBGYN with their moms. So I didn't do that. It would have been great if we had done that. But I think it's really helpful when they come in as a mother-daughter pair, and we talk about all of the health benefits of a birth control pill to control their cycle and the amount of bleeding they're having and the amount of pain they're having, as well as if they were to be sexually active. But I think part of the reason why we don't necessarily have it brought up is because people are uncomfortable bringing up those social barriers to me even. So
Sure.
Now I always, and we're all trained to ask anyone in the room to leave when I meet someone for the first time. So there's always a time period when I'm like, and then I do just talk to everyone by themselves. So if you wouldn't mind just popping into the hallway. And I have not personally been in a situation where somebody was like, I want to be on this, but I don't want this other person in the hallway to know that. But I'm sure that that's something that people are not bringing up because they feel uncomfortable.
In our organization, when we talk about the work we do, there's a story that comes up where a woman, I think she was on her 4th or 5th child, but her insurance, her coverage was through her husband, who did not think birth control was worthwhile or something he believed in.
Mm-hmm.
And so she used our services at a step ahead so that it wouldn't be filed on his insurance because she could not handle another child, the burden there. And I mean that because it's a lot of weight. On a mom, I have one, I can't imagine 4.
Absolutely.
So, I mean, these are the kind of the barriers that
Yes.
women in our region are facing.
I feel like the biggest barrier that I see on a daily basis is education. I feel like no one's going to seek something out if they have no idea what it is.
Sure.
Or how it works.
Or what it helps.
Or what it helps. Then also there's a lot of misinformation, specifically on social media, Instagram, TikTok, Facebook, what people tell each other. Everyone always says to me, no, I heard a horror story about that IUD.
Sure.
But the IUD is the most popular long-acting form of birth control.
And effective.
And extremely effective. The only thing that is more effective than that is the arm implant. And then the number of horror stories, if you will, that I have personally witnessed, I could count on one hand compared to the thousands that are placed every day in my office. So I do feel like if there was better understanding of how birth control works, how it could make your life better in certain ways.
Absolutely.
Now, if you have no problems at all, like your periods are not very heavy, they're not very painful, you are able to track your cycle, it's very predictable. I mean, maybe you choose to not have birth control, but I feel like the majority of people would like to be able to reliably prevent pregnancy and not just play a guessing game.
That is something that before getting involved in this organization, I had taken for granted, a privilege I didn't know I had. I've grown up in a large city. I went to school in a large city. I've then as an adult moved to large cities, and I didn't have an issue accessing not only generalized healthcare, but specialty in women's healthcare. I just go down the road and just call whichever one my friends recommended. That's who they go to. I can't believe that in the counties that just we serve here, that there are counties without a provider at all. And
Right.
On top of that, we've seen a significant decrease in providers available and leaving our state since 2022.
Correct. And in fact, Claiborne County, Campbell County, and Union County all went from some provider to 0 providers in 2023, and Scott County actually never had any.
The idea that in 2025 we have counties in our state that have 0 women's health providers is wild, and something I don't think majority of people know or think about. But that is why A Step Ahead exists. We are here to remove those barriers, whether they are geographic. We have locations all over our 16 counties with providers that work with us. We cover the cost of your exam, your insertion, any pregnancy or STI testing, and the follow-up appointment later to make sure it's not been expelled, or maybe the strings of your IUD bother you. And we also take care of those transportation issues as well. We will get you a ride. We will pay for your gas money. We will get a bus ticket. Whatever your barrier is, please reach out, and we exist to remove that barrier for you.